Once a month, these seniors get together at the public library in South Austin, Texas, to talk about what's going on in their lives. This week, Medicare looms large.
I wonder, where would my friends and neighbors who are retired be if it weren't for Medicare?
It's a crisis, especially in the primary care area.
What they're talking about is how it's getting harder and harder to find doctors who'll treat Medicare patients. For one of the group's members, 78-year-old Nancy Martin, the search was particularly tough. After moving here from Lubbock in 2007, she spent hours calling primary care doctors.
I'd say, I'm Nancy Martin. I have just recently moved to Austin. I'm looking for a physician that will take a new Medicare patient. Sorry, we're not taking any new Medicare people. I felt frustration, disappointment, I would say despair. A lot of days just get to the point where I thought, I'm never going to find a doctor in Austin. What do you think I'll have to do? I don't know.
Martin has high blood pressure and type 2 diabetes.
If I had something bad, I just went to the emergency room.
After 2 years of searching, Martin finally found a primary care physician.
It's nice to see you today.
Thank you.
There are differing estimates on how widespread the access problems are for Medicare recipients nationally. Only a handful of health organizations have even tried to study the issue. But Texas has one of the few state medical associations that has.
Patients are having a much harder time finding a doctor who will accept Medicare. This is Lou Goodman.
Lou Goodman is the CEO. With 47,000 members, it's the largest state medical society in the U.S.
And in 2000, we had about almost 80% of the doctors were taking new Medicare patients. We just completed a survey last year, and we found that less than 60% were taking them. Almost 20% fewer doctors are taking new Medicare patients. And that really troubled us.
Goodman says the primary reason doctors are not taking new Medicare patients, or opting out altogether, is because of something called the sustainable growth rate. It's a mathematical formula established by Congress in 1997 to contain rising Medicare costs. But in practice, it would have cut government payments to physicians for treating Medicare patients every year since 2001. So every year, Congress, at the last minute, passes the so-called doc fix, averting the cuts and giving doctors a small raise. The annual doc fix and the threats of lower reimbursements in future have left some doctors insecure and unwilling to take on more Medicare patients. Tricia Newman tracks Medicare for the Kaiser Family Foundation.
Over the years, a number of problems have emerged with the formula, and it has resulted in a threatened reduction in payments for physicians each year. So this year, for example, had Congress not taken action, physician fees would have been lowered by 30% approximately, and nobody really wants that to happen.
Congressional leaders have talked about passing a permanent payment fix, but each time they get close, they've been scared off by the estimated $138 billion price tag. That's left some physicians to make tough decisions.
Anybody sick at home?
Last year, the Austin Regional Clinic, or ARC, bit the bullet and stopped taking new Medicare patients. ARC, one of the largest healthcare groups in Central Texas, serves more than 400,000 area residents. Dropping Medicare was not something the health system wanted to do, but CEO Dr. Norman Chenvin says it was an economic necessity.
The issue was really one about survival. It's really time and materials that it takes to provide care to someone. We can pretty much predict that if our Medicare population grows beyond a certain percentage, that our profitability is going to go away.
The Texas Medical Association says this chart tells the story. Since 2001, Medicare payments to hospitals and nursing homes have steadily gone up, but those to physicians have remained flat. Meanwhile, the cost of running a practice, according to the Texas Medical Association, has increased between 25% and 50%. But it isn't just money that's driving the exodus. 2 hours west of Austin, in the Texas Hill Country, Dr. Janet Shane says it was government rules and stepped-up audits for fraud that drove her to opt out of Medicare altogether.
I didn't see any way that I could stay in that program and give my patients a level of care that I want to give them. Take some deep breaths.
Dr. Shane says Medicare criticized her for spending too much time with her patients.
I'm a family doctor. I'm not, a specialist. I'm just taking care of their toe or their eye. This is the oldest, sickest part of our population, and I felt I was being pushed to herd them through in a turnstile way in 15 minutes or less.
Medicare makes up nearly a quarter of the nation's health care spending on physician services, according to the Centers for Medicare and Medicaid Services.
Any tingling pain or?
Shane says even though she stopped taking those seniors, she doesn't believe they've had trouble finding another doctor. And Kaiser's Tricia Newman says their research indicates it's not a widespread problem.
We just did a survey last year, and in fact, only 3% of seniors said they had trouble finding a doctor who would take Medicare. There could be certain situations where a senior may not be able to get their first choice in terms of physicians, but in general, there are physicians available who would see them.
The independent Medicare Payment Advisory Commission also looked at the problem last June. Of the 6% of seniors they surveyed looking for a new primary care physician, 1 in 4 had a small or big problem getting an appointment. And Medicare itself says fewer than 10,000 doctors have officially opted out of the program in the past 2 years. But Texas Medical Association's Goodman thinks that's just the tip of the iceberg.
I think we're going to have a real shortage and a real problem. There are data on both sides of that argument. Our surveys show that we're going to have a huge influx of seniors, but also not enough doctors to take care of them, no matter what. I think what could happen is our emergency rooms could get flooded. And as we know, emergency rooms are the costliest place to get care.
Dr. Chenvin says making a permanent doc fix isn't all that needs to be done to keep physicians in the Medicare program. Doctors get paid by Medicare based on fee-for-service. Each service is paid for separately, giving incentive for physicians to provide more treatments regardless of the outcome.
That has to change for us, for this country to figure out a better way to deliver care.
Every day, about 10,000 Americans turn 65, and it's estimated more than 25 million new Medicare recipients will be in the program by the year 2020.